Let's discuss the Chinese medical theory, the Chinese versus Western medicine, part 3. To illustrate the difference between the TCM and the modern Western medical approach to illness, take a common example of a patient who has just recovered from influenza. He is free of virus but has a persistent cough with yellowish or greenish bacterially infected sputum. Suffers from weakness and irritability and feels dry in the throat and warm in the body even though his temperature is normal. His tongue is red with a thick layer of yellowish cover. Or from TCM diagnosis, these are the classic symptoms of internal heat with warm phlegm. Treatment consists of using cooling herbs that, according to the Chinese pharmacopoeia, reduce and eliminate internal heat, as well as other herbs that resolve phlegm. A week of herbal medication usually solves the problem, but if the patient is run down and feeble, it could take longer. At this stage, if the patient to need assistance dealing with bacterial infection, he may decide to prescribe a Western antibiotic to supplement the herbal prescription. After the cough and internal heat have subsided, a Chinese medical tonic may be prescribed to enhance the body's ability to restore balance and prevent a relapse. The Western doctor would typically view the patient as having sputum in his respiratory system because of a secondary bacterial infection. The patient feeling of body warmth and irritability merely a transient after effect of the viral infection. The usual treatment would be a course of antibiotics to kill off the bacteria and an expectorant to deal with the sputum. It is not uncommon for such a condition to require repeated doses of antibiotics if the infection returns after the antibiotics are stopped. After the sputum dries up, a dry, persistent cough often follows that could drag on for weeks. The TCM physician in Asia often encounters such patients whose cough have not recovered with Western medicine and therefore seek alternative treatments. There appears to be some anecdotal evidence that such patients find faster and more permanent relief with herbal treatments that aim in clearing heat and phlegm and rebalancing the body. In this example, the TCM physician uses what he considered a holistic view of symptoms presented by the patient, which enables him to draw conclusions about the nature of imbalance in the patient's body. In TCM parlance, the patient's imbalance is caused by internal heat and phlegm. This approach is different from that of Western medicine based on cellular biology, which aims at eliminating an offending microbiological pathogen, bacterium found in sputum, and inducing the lungs to throw off the sputum that causes discomfort, this being the role of expectorant. Can the two approaches be reconciled? It is tempting to give biomedical interpretations to the TCM medications. Perhaps the herbs have antibiotic and expectorant properties. Many Chinese herbs do indeed have antibiotic properties, but in forms too attenuated to be really effective in killing the bacteria involved. Herbs for resolving phlegm are deemed in TCM theory to have the effect of stopping the body from producing sputum rather than just expelling it. The modern TCM physician, drawing on his Western medical training, would view the bacterial infection as a consequence of the underlying imbalances in the body. The underlying condition, the imbalances, is internal heat and phlegm. Its presence encourages secondary bacterial infection to take hold. Hence, the real solution is not to kill the bacteria, but remove the root of the problem, namely eliminate internal heat and phlegm and thereby restore balance. With internal balance, restore the body's own defenses, overcome the bacteria eventually. When the TCM physician adds the antibiotic, the aim is to assist weaker patients particularly the elderly whose body defense take too long or inadequate for a satisfactory recovery. In this latter respect, the TCM physician approach is not unlike that of more conservative Western physicians who would not prescribe antibiotics for a condition such as the one described above, except as a last resort for frail patients with life-threatening infections. The conservative doctor prefers the body to use its own immune system to overcome the infection, thereby strengthening it for further battles, but also reducing the incidence of bacterial mutation and becoming resistant to the antibiotic use. Thank you for your attention.
The scope of inquiry in interviewing. Inquiry allows the practitioner to obtain information about the patient's experience of pain or other non-observable phenomena, making it a very important component of the patient-practitioner interaction. Inquiry is one of the 4 key diagnostic methods in TCM. Practitioners inquire of the patient or her representative about the disease process, onset, development, treatment, present symptoms, and other information. Inquiry examination is verbal interaction with the patient or her representative to obtain information used to develop an accurate diagnosis. Inquiry can assist in collecting information where the other 3 methods, observation, listening, and smelling, and palpation, were insufficient. Aspects of the patient need to be understood in order to determine the etiology, thermal nature, and history of the disease. These aspects include her pastimes, living environment, both climate and social environment, and customs, as well as the onset, development, and prior treatment of the illness. This additional information will assist in making a diagnosis and developing an appropriate treatment strategy. In order to obtain the most accurate information from the patient, the following items should be considered. The practitioner should be amiable and sympathetic to the patient's feelings. The practitioner should focus on the patient's chief symptoms or complaints. The practitioner should give the patient necessary prompts if the patient fails to talk about his or her disease clearly or comprehensively. A patient in critical condition should be given immediate emergency treatment after a brief inquiry and examination. During an inquiry, the practitioner should use simple language rather than relying on medical terms. The practitioner is expected to accept the patient's answers with the utmost concentration and natural expression on her face, and without surprise, frustration, or a pessimistic reaction to the patient's responses. Inquiry is one of the most important examination techniques in TCM diagnosis. There are 2 main areas of questioning. First, there is the standard biographical information provided during a patient's first encounter with the practitioner, such as name, contact information, previous medical history, personal life history, and the family's medical history. Second, there are questions unique to the changeable nature of a health condition, such as the chief complaint and present medical history. General data can help the practitioner get to know the patient, contact and follow up with her, as well as provide basic reference information to help manage the case. General data includes the following: name, gender, age, marital status, occupation, race, birthplace and nationality, address, phone number, email address. The chief complaint are the symptoms the patient feels with the most severity and are usually the main cause for visiting a practitioner. They include the following: major symptoms or chief symptoms, duration and frequency, severity and character. Chief complaint example number 1, dull lower back pain over 3 years, which has become severe with intermittent and sharp pains over the past 2 days. Chief complaint example number 2, cough and constant high fever with dull chest pain for 2 days. Present medical history comprises the primary content of inquiry. It refers to the entire developing course of a condition from its onset up to the present and includes the following aspects. Onset of the disease will help the practitioner assess the deficient or excessive condition of the antipathogenic qi and the thermal nature of a disease. This includes time and duration, the date of onset and period since, cause or inducing etiological factors, mode of onset, sudden or gradual. The characteristics of the chief symptoms will help the practitioner identify the location and the thermal nature of pathological changes. Location, thermal nature, heat or cold. Accompanying symptoms or other symptoms that accompany the chief complaint or symptoms. Inquiring about the development of a disease chronologically from its onset to its present state. These questions include the following: when and why the symptom is aggravated or alleviated, whether its existence is temporary or persistent, when and why it changes. The course of diagnosis and prior treatment by other practitioners, practitioner or other physician, examination and results, diagnosis, treatment, medication. This should include dosage, method of application, duration, result, and side effects. The patient's past health condition and diseases serves as a reference for the present disease and includes the following: past health condition, both health or illness, past diseases. Personal life history includes the history of the patient's lifestyle, such as life experience, the personal and work history, pastimes, recreation, addictions, emotional status, diet, lifestyle, working condition. Learning about the state of health and diseases that the patient's relatives had may be helpful to making a diagnosis about certain infectious or hereditary diseases. Thank you for your attention.
Let's continue discussing the 4 principles of yin yang and its application to medicine. The opposition of yin yang is reflected in medicine in the opposing yin-yang structures of the human body, the opposing yin-yang characters of the organs, and most of all, the opposing symptomatology of yin and yang. No matter how complicated, all symptoms and signs in Chinese medicine can be reduced to the elemental basic character of yin or yang. In order to interpret the character of the clinical manifestations in terms of yin-yang, we can refer to certain basic qualities which will guide us in clinical practice. These are: fire is the yang, water is yin, heat is yang, while cold is yin, restless is yang, quiet is yin, dry is yang, while wet is yin, hard is yang, while soft is yin, excitement is yang, while inhibition is yin, rapidity is yang, slowness is yin, non-substantial is yang, while substantial is yin, and transformation and change is yang, while conservation, storage, and sustainment is yin. Now let's talk about fire and water. This is one of the fundamental dualities of yin-yang in Chinese medicine. Although these terms derive from the 5-element theory, there is an interaction between that and the theory of yin-yang. The balance between fire and water in the body is crucial. Fire is essential to all physiological processes. It represents the flame that keeps alive and stokes all metabolic processes. Fire, the physiological fire, assists the heart in its function of housing the mind or the shen. It provides the warmth necessary to the spleen to transform and transport. It stimulates the small intestine function of separation. It provides the heat necessary to the bladder and lower burner to transform and excrete fluids. And it provides the heat necessary for blood moving. If the physiological fire declines, the mind will suffer with depression. The spleen cannot transform and transport. The small intestine cannot separate the fluids. The bladder and lower burner cannot excrete the fluids, and there will be edema, and the uterus turns cold, which may cause infertility. This physiological fire is called the fire of the gate of life, or the membrane, and derives from the kidneys. On a clinical note, the physiological fire of the body is essential to all physiological processes and to the mind. Deficiency of the physiological fire will cause depression. It is stimulated by using moxa on kidneys 3 and 4. Water has the function of moistening and cooling during all the body's physiological functions to balance the warming action of the physiological fire. The origin of water is also from the kidneys. Thus, the balance between fire and water is fundamental to all physiological processes of the body. Fire and water balance and keep a check on each other in every single physiological process. When fire gets out of hand and becomes excessive, it has a tendency to flow upwards. Hence, the manifestation will show on the top part of the body and head, with headaches, red eyes, red face, or thirsts. When water becomes excessive, it has a tendency to flow downwards, causing edema of the legs, excessive urination, or incontinence. Now let's go to heat and cold. Excessive yang is manifested with heat, and excessive yin is manifested with cold. For example, a person with excessive yang will feel hot, and one with excessive yin will tend to feel always cold. The hot and cold character can also be observed in certain signs themselves. For example, a large single boil that is red and hot to the touch indicates heat. A lower back area very cold to the touch indicates cold in the kidneys. Thank you for your attention.
Let's discuss the extraordinary yang organs, the uterus part 3. Relationship with the internal organs, the kidneys. The uterus is connected to the kidney via a channel called the uterus channel, the Baolu, and to the heart via a channel called the uterus vessel, Baumai. The connection with the kidney is very important and well known, that is, the kidneys are the origin of menstrual blood. They are the mother of the liver, which provides blood to the uterus, and closely connected to the directing and penetrating vessels, which regulate qi and blood in the uterus. Chapter 1 of the simple question explains the origin of menstrual blood. When a girl is 14 years old, Changay arrives, the directing vessel is open. The penetrating vessel is flourishing, and she can conceive. Thus, menstrual blood is not blood in the same way as the blood that nourishes the sinews, for example, but it is a precious fluid deriving directly from the kidney essence and is equivalent to a sperm in men. So we have here the illustration of the relationship between the uterus, kidney, and the heart. Next, we go to the heart. The heart is connected to the uterus via the uterus vessels, and this explains the strong influence of emotional problems on menstruation. More specifically, the heart qi and the heart blood descends towards the uterus, promoting the discharge of menstrual blood during the bleeding phase and the discharge of the egg during ovulation. The heart also controls the two moments of transformation, that is, transformation of the yang to yin with the beginning of bleeding, and that of yin to yang with ovulation. In other words, the beginning of bleeding and the ovulation are two moments of transformation during the tide of yin and yang, and two moments of change from yang to yin and from yin to yang. The descending of heart qi and the heart blood towards the uterus ensures that these two moments of transformation occur smoothly and at the right time. The heart influences the uterus also because it governs blood, and this indirectly nourishes the uterus in a similar way as liver blood does. For example, heart blood deficiency may cause amenorrhea, heart blood heat may cause menorrhea, and heart blood stasis may cause painful periods. Finally, heart influences the menstruation as heart yang descends to meet the kidneys to contribute to forming Chiangge, that is menstrual blood. The heart influences the uterus and the menstruation in 4 ways. First, heart chi and heart blood descends to the uterus to promote the discharge of menstrual blood during the period of the eggs during ovulation. Number 2, descending of heart chi and heart blood brings about transformation of yang to yin with the onset of the period and of yin to yang with ovulation. Number 3, heart governs blood and heart blood nourishes the uterus. Number 4, heart yang descends to meet the kidney essence to form Chiangge, that is menstrual blood. Thank you for your attention.
We continue with treatment principles, root and manifestation. When considering the root and manifestation, it is important to understand the connection between the two. They are not separate entities, but two aspects of a contradiction, like yin and yang. As their name suggests, they are related to one another, just as the roots of a tree are connected to its branches. The former under the ground and invisible, the latter above the ground and visible. The same relation exists between the root of a disease and its clinical manifestations. They are indissolubly related, and they form two aspects of the same entity. There is no separation between the two. For this reason, it is not entirely correct to translate pen as cause, since the relation between the root and manifestation is not a causal one. The root is not the cause of the branches, but the two together form the entity of a tree. The art of diagnosis consists precisely in identifying the root, that is, the root of symptoms and signs, by looking at the manifestation, that is, the clinical manifestations. For example, if a person has diarrhea, chilliness, tiredness, poor appetite, abdominal distension, a weak pulse, and a pale tongue, the complex of these clinical manifestations clearly points to its root, that is, spleen-yang deficiency. In this simple example, therefore, spleen-yang deficiency is the root, and all the symptoms and signs are the manifestation of the disease. It is only when we master the art of pattern identification that we can identify the root by looking at the pattern woven by the manifestation, much like a botanist can identify a tree by looking at its leaves. To give an example of original and deriving pattern as root and manifestation, spleen-2 deficiency may be the original pattern or root, and dampness the deriving pattern manifestation. In endometriosis, often a deficiency of kidney yang is the root, while blood stasis is the manifestation. Please note that clinical situations may be very complicated, as a manifestation may in turn become a root. In the example given, kidney yang deficiency, the root may give rise to blood stasis, the manifestation, and this in turn may cause dryness, a manifestation. So here we have the schema of a manifestation becoming the secondary root. So from kidney yang deficiency to blood stasis, which will eventually lead to dryness. Thank you for your attention.
Let's continue with diagnosis according to Zanko organ patterns, in particular, lung vein code invasion. Let's look into invasion of vein code in the lungs in excess patterns. An invasion of vein code is an acute pattern that does not usually last for extended periods of time. The vein code either being quickly expelled from the body or transforming into heat and penetrating deeper into the body. It is nevertheless important to diagnose and treat this condition correctly. Furthermore, it is important to remember that it is the symptoms that define the pattern of imbalance. If a person manifests with symptoms of vein code, then there is vein code. This is relevant, for example, in the diagnosis of hay fever and other allergic reactions. Its etiology. There will be a powerful heat chi that has been potent enough to pierce the body's weight chi. The invasion can arise if the person has been exposed to climatic wind or cold, but it can also arise after exposure to artificial air conditioning. Furthermore, some allergens and pollutants can also provoke a wind-cold pattern of imbalance. There may be underlying weight chi deficiency, which means chi does not require the same strength to be able to penetrate the body's defenses. Its symptoms and signs: there will be acute headache, stiffness in the neck and upper back. There will be joint pain, skin and muscle aches, aversion to cold and wind, lack of sweating in an exhaust condition, and perspiration that does not relieve the symptoms when there is weight chi deficiency. There will also be possibly a slight fever. There will be coughing, sneezing, slight breathlessness, an itchy throat. The person will pack themselves into warm clothing. The person will have a stooped posture. There will be thin, white, moist coating on the tongue and a superficial and tight pulse. The key symptoms here are sore, aching muscles and joints, aversion to cold, superficial and tight pulse. The treatment principle: open the exterior, expel wind and cold, and activate weight chi. For the acupuncture points, you can choose from lung 7, Li4, gallbladder 20, bladder 10, bladder 12, bladder 62, and SI3. For the needling technique, we can use draining. We can also use vacuum cups on bladder 12 or gua sha on the upper back is recommended. As for the explanations of the points, lung 7 and Li4 regulates the lung functions of descending and spreading, activate weight chi, and expel wind and cold. GB20, bladder 10, and bladder 12 expel wind and activate weight chi. SI3 and bladder 62 expel exogenous chi from Tai-Yang aspect. A relevant advice: when there are invasions of wind cold, it is advisable to consume beverages that are hot and spicy to open the exterior and expel chi. This could be, for example, ginger, garlic, whiskey, brandy, or chili. Fasting is also advisable, or only eating soups such as onion soup. There are two reasons for this. First, when temporarily fasting, chi will not be used to transform food and therefore can be used to combat the invading chi. Second, some sources say that the downward movement of food and chi in the stomach can draw the exogenous chi inwards from the surface. Similarly, the sour flavor should also be avoided due to its astringent or centripetal dynamic. Vitamin C, lemon, and other things that are very sour or should not be consumed during an invasion of exogenous heat cold, as they will draw the heat cold inwards while closing the pores in the skin, thereby preventing the cold from being expelled again. This also means that antibiotics are not recommended at this stage as they are cold and drained onward. So invasion of wind cold can be caused by the following pattern of imbalance. Lung chi deficiency. Invasion of wind cold can result in the following pattern of imbalance: wind heat, phlegm, heat in the lung, phlegm fluid in the lung heat, yang heat, and Shaoyang disorders. So to summarize, wind cold invading the lung usually is due to exposure to exterior wind and cold, a relative weakness of the body's chi in relation to pathogenic factors. It will manifest with aversion to cold, fever, cough, itchy throat, slight breathlessness, stuffed or runny nose with clear watery discharge, Sneezing, occipital headache, body aches, absence of sweating, heavy voice, and itchy throat, cough, and the absence of thirst. The patient will also have a floating and tight pulse in a thin white tongue coating. For its treatment principle, we dissipate wind cold, diffuse the lung, and suppress cough. For the acupuncture treatment, we may use lung 7 as it releases the exterior and expels wind. GB20 expels wind. Do16 also expels wind. Bladder 12 expels wind and releases the exterior. Sanjo 5 expels wind and benefits the head. Li4 releases the exterior, and bladder 13 suppresses cough and regulates lung qi. We need a good drainage for headache. We add Do20 and Si3. For absence of sweating, we add kidney 7. For nasal congestion and running nose, we add lung Li20 and extra point in tongue. For cough, we add bladder 13 and bladder 11. Thank you for your attention.
Let's discuss the diagnosis according to 8 principles. Exterior imbalances. In exterior imbalances, the symptoms and signs are manifesting in the channels between the skin and muscles, the wei qi aspect, or in the skin, muscles, and tendons. It is always necessary to incorporate other principles into the diagnosis of exterior imbalances, such as whether there is exterior heat or exterior cold, or whether it is an exterior deficient or an exterior excess condition. Exterior imbalances are often, but not always, acute. They are usually caused by invasion of exogenous evil qi. Typical example of such patterns are invasions of wind cold or wind heat. An example of a chronic exterior imbalance is when evil qi blocks the channel. This will result in B syndrome or painful blockage syndrome. The Western diagnosis of arthritis would, for example, fall within this category. Skin disorders are not necessarily exterior imbalances. Eczema, psoriasis, acne, and so on are often caused by blood imbalances and interior heat. This means that they are usually exterior manifestations of interior imbalances. Exterior patterns will usually have little or no impact on the functioning of the Sangfu organs. Next, let's discuss the acute exterior imbalances. The exterior condition will typically be an excess condition. This is because acute exterior conditions are usually due to the presence of evil qi. There may well be a concurrent deficient condition, for example, with qi deficiency, in which case it will be a deficient or excess condition. The symptoms and signs in an exterior deficient condition will be milder than in an exterior excess condition. In addition to the symptoms and signs of an exterior condition being dependent on whether it is a deficient or excess condition, they will also be different if the condition is a hot or a cold condition. Exterior patterns will typically be acute, and there will usually be tangible symptoms and signs that indicate that wei qi has been disrupted in the circulation and functioning. When wei qi is blocked by exogenous evil qi, it will not be able to warm the skin and muscles, resulting in the person having chills. The blockage of wei qi will also manifest with pain and tenderness of the skin and muscles. Cold in the exterior will often disrupt the Taiyang channel. This is typically seen when there being stiffness and pain in the neck and head. Invasions of cold will block wei qi from controlling the pores in the skin. This will manifest with the person either not being able to sweat, excess condition, or sweating spontaneously without this relieving the symptoms, deficient condition. Because wei qi is compromised, it cannot defend the body against exogenous evil qi. This will be seen in a person experiencing an aversion to cold, drought, and wind. This aversion is most pronounced in a deficient condition. The conflict between Wei Qi and evil Qi can generate heat, and therefore there may be a fever. This will be a much more significant when there is exterior wind heat. An important differentiation in Chinese medicine is between the symptoms and signs seen in exterior heat condition and interior heat conditions. A key symptoms when differentiating these two patterns is whether there is a concurrent fever and aversion. In interior heat, there is no aversion to cold while there is fever. This will be the case when there is exterior wind heat. Headaches can be a symptom of an exterior imbalance, but there is a difference in the headaches seen in various exterior imbalances. Invasions of heat in the exterior can manifest with a throbbing headache. This is due to the young expanding nature of heat. Exterior cold can manifest with a tight and tense headache due to cold's contracting dynamic. Invasions of dampness in the exterior yin excess can result in a heavy headache. An invasion of heat in the exterior can cause a person to feel thirsty because the heat will injure the body's fluid. The pulse in exterior condition will be superficial because there is increased activity in the superficial aspect of the body. The pulse that is felt when there is wind heat will be superficial and rapid. Wind cold will manifest with a pulse that is superficial and tight, while a wind dampness pulse will be superficial and slippery. The strength of the pulse will reflect whether it is a deficient or excess condition. In deficient condition, the pulse will lack strength. Because these are acute imbalances, visible changes in the tongue will rarely be observed. If there are changes, this will manifest with changes in the coating in the front and at the edges of the tongue. We have here the table, differences between the exterior heat and the exterior cold. In the exterior cold, we have the immediate symptoms, while the exterior heat, there is immediate, delayed or gradual symptoms. There is a strong aversion to cold in exterior cold, whilst in exterior heat, there is no or only a slight aversion to cold. There is mild fever or no fever in exterior cold, and in exterior heat, there is a fever. There is tight or tense headache in exterior cold, while in exterior heat, we have the throbbing headache. There's no thirst in exterior cold, while in exterior heat, there is thirst. There's tight and superficial pulse in exterior cold, while in exterior heat, there is rapid and superficial pulse. Next, the difference between exterior deficiency and exterior excess condition. In deficiency, there is spontaneous perspiration or sweating that does not alleviate symptoms, while in excess, there is no sweating. In deficiency, there is extreme aversion to wind and drought, while there is aversion to cold in excess. In deficiency, there is milder symptoms, while in excess, there is a strong symptoms. In deficiency, there is an empty pulse, while in excess, there is full and superficial pulse. Thank you for your attention.
Let's talk about depression, the Western medicine view. The main categories of mental illness mentioned in the classics are as follows. Lilium syndrome, this is mentioned in the essential prescriptions of the Golden Cabinet. Depression, Plumstone syndrome, agitation, palpitations and anxiety, manic depression, hysteria, cretinism. Depression, as defined in Western medicine, has aspects of the first 5 ancient disease categories. Lilium syndrome, depression, Plumstone syndrome, agitation, and palpitations and anxiety. Depression is the most common mental disorder in the population. It is twice as common in women as in men. At a global level, it affects 4.4% of the world's population and represents one of the leading causes of disability worldwide. So here is the correspondence between Chinese mental emotional conditions and depression in Western medicine. If compared with other mental health conditions, for example, anxiety disorder, it shows a wider variation in age of onset. The peak risk period for onset of major depressive disorders ranges from late adolescence to the early 50s. A depressive illness is primarily characterized by a change in mood consisting of a feeling of sadness that may vary from mild despondency to the most abject despair and may cause symptoms such as indifference, apathy, or irritability, usually accompanied by changes in sleep patterns and weight, loss of appetite, lack of energy or psychomotor agitation, feelings of fatigue or guilt, and thoughts of suicide. Some diagnostic criteria must be met for a major depressive disorder to be diagnosed. Severe criteria of a major depressive episode, according to ICD-10, are: the episode must last at least 2 weeks and cannot be attributed to the abuse of psychoactive substances or to an organic mental disorder. General criteria: presence of at least 2 of the following symptoms: depressed mood, loss of interest or pleasure, lack of vitality, or increased fatigue. Presence of 1 or more symptoms of the following list so that the sum total is at least 4:1. Loss of confidence and self-esteem, feelings of excessive guilt or inadequacy, thoughts of death or suicidal behavior, decrease of the ability to concentrate, changes of psychomotor activity with agitation or inhibition, sleep alterations, changes of appetite with corresponding weight change. The ICD-10 divides major depressive episodes into mild, 2 or 3 of the symptoms of criteria B are present; moderate, at least 2 of the symptoms of criteria B are present, in addition to symptoms of criteria C. Until there is a minimum total of 6 symptoms, or severe, there must be 3 symptoms of criteria B in addition to symptoms of criteria C until there is a minimum of 8 symptoms. Depression may be accompanied by the so-called somatic symptoms: amenorrhea, loss of libido, psychomotor retardation, restlessness, and constipation. People with depression usually experience worse symptoms in the morning and tend to wake up early. Some people find it difficult to get a correct diagnosis of depression. Therefore, considering the global high prevalence of this condition and its remarkable impact on quality of life, it is important to administer the patient health questionnaires 2 and 9 as appropriate screening tools to the general adult population. In distinguishing the normal reaction from pathological depression, a quantitative judgment has to be made. If the precipitant seems inadequate, the depression too severe and too long-lasting, the condition is regarded as abnormal. In addition, the severity and incapacity in depressive illness differs qualitatively as well as quantitatively from depressed feelings that are part of normal experience. When making a diagnosis, other conditions that may cause depression should be ruled out, such as chronic diseases and the abuse of drugs or other illegal substances. In elderly patients, depression may present with symptoms that mimic dementia, and these individuals have a high suicide rate. The findings of twin studies have demonstrated evidence of a strong genetic component for early onset depressive disorders before 25 years, which could modulate the response to stressful events such as the death of a close relative, an act of aggression, or serious relationship problems. Nevertheless, mechanisms associated with the pathogenesis of depression have yet to be completely understood, and it is estimated that only 50% of the patients respond to drug treatment. Thank you for your attention.